Hello my people, I hope that you are doing well. This is Ishmael MIVHT representing Mtumishi Ishmael Volunteer Health Talks. We have been giving you health talks, and today I want to do an episode about family planning. I had done an episode earlier about the characteristics of normal methods of family planning, or rather an ideal method of family planning, the characteristics that it should have. And so today I want to do an introduction to the family planning. What is this family planning? And without wasting time, family planning is just a conscious decision-making process, that individuals make, or rather the couples make, towards regulating the number and the spacing of their children. This conscious decision-making process is just aimed at regulating the number and the spacing of their children. And as the word suggests, conscious, it means that it is a decision that needs to be made by sober people. The people who are making a decision to choose a particular method of family planning, they should be conscious, they should be sober, because it is a serious decision. Therefore, the aim is to regulate how many children. And for people who want to use family planning methods, there are 3 questions that they should ask themselves. Number 1, when are we going to have our firstborn? Number 2, after we have gotten our firstborn, when are we going to have our second child? Number 3, when are we going to stop this business? So for people who are planning to use family planning, they should ask themselves 3 questions. When are we going to have our firstborn? When are we going to have our second child? That is the spacing now. And lastly, when are we going to stop this business? So this is basically 3 questions that any couple that needs to use family planning should ask themselves. A question comes now: who is eligible for using family planning methods? I will answer this and say, any person of reproductive age is eligible for using family planning methods. Let me clarify this. A boy who has started having wet dreams is capable of impregnating and therefore can use family planning. Which family planning method can a boy use? I will say, a girl who has started having menses means that she has reached the reproductive age. It means that the eggs are mature. She can release mature eggs, and this means that she can conceive. So any person of the reproductive age can use family planning methods. A question comes then. You see, this generation is very funny. They will not fear from having unprotected sex. They will not fear to come to the hospital to ask for abortion. And this means that an awareness should be made that if people have reached this age, they should be able to use family planning methods, because they won't shy off from having unprotected sex, and they will also not fear from asking for abortion, but they will fear from asking for family planning. So I think it is very crucial, very important to create awareness. So family planning involves use of various contraceptive methods, and reproductive health services to achieve the desired family size and timing of births. So this family planning will use various types of contraceptives and healthy reproductive services in order to achieve the desired family size. So what is the goal of family planning? The goal is to enable individuals or couples to make informed choices about when to have children and how many to have. So the goal is to enable couples to plan on when to have children and the number of children that they need to have, and these will promote better health outcomes for both parents and children. So that is the goal. So briefly, let me mention something about the importance of family planning. One, for health benefits. A couple can choose to have family planning for healthy benefits because proper spacing between pregnancies reduces the risk of maternal and infant mortality. So when you have proper spacing, it promotes the health of both the mother and the infants, and it also reduces the risk of infant mortality, the rate of childbirth, because at some point when you don't have proper spacing, you may give birth to very weak babies, very weak children, and they are predisposed to mortality. So family planning will have health benefits to both the mother, the maternal, and also the child. And secondly, it also reduces the complications during childbirth. It reduces the complications. There are so many complications that may be there. Like for example, this first delivery, you may have cesarean sectioning, and the other one, if you don't space it well, you will also have cesarean sectioning, and this can weaken your system. So the other one is the importance of family planning is that it reduces poverty. Did you hear me? It reduces poverty. You know, when a family is of a sizable, is of what? A small family, a sizable family. You know, parents who have fewer children will utilize their resources well. They will provide better nutrition. They will provide better health care. They will provide education. And this all reduces poverty. Many families that have many children will have poverty because the resources are limited and all that. So family planning will help to alleviate poverty. And also adolescent pregnancies can be minimized because when they use family planning, then we won't have unwanted pregnancies. And so I want to mention something about the choice of family planning. Depends on what? What will make you decide on which method to use? One, you will consider individual circumstances. The circumstances that you have as an individual will help you determine the kind of family planning that you're going to have. Like the frequency of sexual activity can influence your choice. And also you'll also consider, number two, you'll also consider healthy considerations, your healthy status. Are you on any medication? Do you have any chronic illness? Yeah. Thirdly, you'll have your personal preferences, your personal considerations, personal options. So those are some of the factors that you can use to determine the type of family planning that you are going to use. And there are statistics. I will mention something about statistics. The number of women desiring to use family planning has increased markedly from the past 2 decades, from around 9 million in 2000 to nearly 1.1 billion in 2021.